Hello, I am Robert Van Howe, the Provisional Medical Director of the Western UP Health Department and the Dickinson Iron District Health Department. I would like to welcome you as we kick off the health improvement process for Dickinson County. The process is an outgrowth of the Upper Peninsula Community Health Needs Assessment, which was released this past summer. The assessment brings together local information from outside sources, such as vital statistics, and statewide and national surveys conducted by a variety of agencies. To augment this information, we generated our own survey, which was randomly distributed to 1,700 households in each of the counties of the Upper Peninsula. The exception is that Keweenaw County, because of its limited population, was combined with Houghton County. Over 3,500 people completed and returned the survey. Questions in the survey were taken from the CDC's Behavioral Risk Factors Surveillance System, thus allowing us to compare our results to those generated across Michigan and across the country. We also asked people to gauge the importance of 16 health priorities to provide direction of where the community needs to go regarding health policies and interventions. A complete copy of the 458-page Community Health Needs Assessment can be found at the Western UP Health Department website, wuphd.org. So why are we here today? We'll briefly review the background and purposes of the Upper Peninsula Community Health Needs Assessment, discuss some of the key findings of our local survey, look at specific data that apply to your county, and explore what steps need to be taken going forward. Let's begin by you telling me a few things that are unique about your county. Each county has things that make it unique. These features are important when it comes to planning what we want health to look like within our county. The Upper Peninsula Community Health Needs Assessment has its origins in the Affordable Care Act, which is more commonly referred to as Obamacare. The ACA requires nonprofit hospitals to perform community health needs assessments on a regular basis. In 2017, the health departments across the Upper Peninsula brought together an unprecedented collaboration of partners across the region and distributed the first UP-wide survey. This survey was the foundation of the 2018 Upper Peninsula Community Health Needs Assessment, which also included secondary data. The 2018 assessment laid the groundwork for the 2021 assessment and provides a baseline that allows us to gauge our progress towards our community health goals. The 2021 assessment continues the collaboration between hospitals, clinics, behavioral health agencies, regional planners, health foundations, as well as the local health departments. We have purposely invited these partners and others from the community to begin the work of using this gathered information to inform the development of policies and interventions to improve the community's health locally. Let's look at some of the key findings from the assessment. We all know that we have an aging population in the Upper Peninsula. Nearly 23% of the population in the Upper Peninsula is 65 years of age or older, compared to almost 18% statewide. An older population translates into greater chronic disease burden, greater needs for home health services, assisted living, and nursing home care. It also means that we need the workforce to provide health care and elderly services. Looking at the figures on this slide, the percentage of those 65 and older in Dickinson County is on par with the rest of the Upper Peninsula, but higher than the state average. One of the issues faced by seniors is living alone. More than 1 in 5 households in Dickinson County is a senior living alone. Living alone increases the demand for transportation and home health services. Chronic diseases such as cancer, heart disease, diabetes, and stroke are the leading causes of death in the Upper Peninsula and across the country. Cancer and heart disease alone account for about half of all Upper Peninsula deaths. They are also largely preventable. Curtailing tobacco use, obesity, the abuse of alcohol, and other drugs would dramatically reduce morbidity and mortality among Upper Peninsula residents. If a value is not given on this table, it's because there were not enough deaths from that cause to provide a reliable estimate. Dickinson County has a slightly lower age-adjusted overall mortality rate, but a higher rate of deaths resulting from unintended injuries. Smoking, alcohol consumption, and diet deficient in fruits and vegetables may each be a risk factor for a variety of chronic diseases. As you can see on this slide, Dickinson County has a higher percentage of use of smokeless tobacco than the rest of the Upper Peninsula. The vaping rate is much lower. Heavy drinking is less prevalent than the rest of the Upper Peninsula, but much higher than the state average. Binge drinking is lower in Dickinson County. Servings of fruits and vegetables is higher in Dickinson County than for the rest of the Upper Peninsula, but slightly lower than the state as a whole. The combination of obese and overweight is lower, and the lack of leisure time activity is on par with the rest of the state, but much higher than the rest of the Upper Peninsula. The continuing opioid epidemic is taking its toll across the region and has a broad impact on maternal and child health, child abuse and neglect, neonatal drug addiction and withdrawal, incarceration, and employment. The number of opioid deaths from using synthetic opioids such as fentanyl continues to increase, while the deaths from prescription opioids and heroin have decreased. Every health department in the Upper Peninsula has a needle exchange program in place that provides strips that can test product for the presence of fentanyl. A measure we incorporated into the current assessment that had not been previously included is known by the acronym ALICE. This stands for Asset Limited, Income Constrained, Employed. It is based on the household survival budget, which is calculated based on the minimum combined local cost of housing, childcare, food, transportation, and a basic smartphone plan. In other words, this is the bare minimum to get by. In Michigan, the average household survival budget for a single adult is equivalent to full-time work at $11.70 an hour. For a household with 2 adults, 1 preschooler, and 1 infant, a full-time wage of $32.06 an hour is needed. The household survival budget is higher than the poverty level, so an income above the poverty level is not necessarily enough to survive on. Those 65 years and older were less likely to be below the poverty line, possibly reflecting the impact of the Social Security payments. Unfortunately, these individuals were more likely to have income that fell below the household survival budget. Using ALICE calculation gives a much more accurate measure of how families are faring financially than relying on the poverty threshold. As you can see from this slide, Dickinson County has a higher rate of households with children living in poverty compared to the Michigan average, and the same rate of obtaining a bachelor's degree or higher. Prior to the implementation of the Affordable Care Act in 2014, 18.5% of Upper Peninsula residents aged 18 to 64 did not have health insurance. By 2017, the rate had decreased to about 7%, and the percentage is now closing in on around 4%. Regardless of one's views on the ACA, it has succeeded in expanding the pool of individuals with health insurance coverage, hence reducing one of the barriers residents experience in accessing health care. Unfortunately, removing this barrier is not enough to solve our access to health care issues. As you can see from this graph, a high percentage of people report having no personal health care provider. It does not do much good to have health insurance if there are not enough providers to take care of you. A third of people in Dickinson County report no dental care in the past 12 months, and over 40% report having no dental insurance. This table illustrates how income impacts health across the Upper Peninsula. The columns are split into those households with annual incomes less than $25,000 per year, those making between $25,000 and up to $50,000 a year, and those households making $50,000 a year or more. The percentage of survey respondents reporting poor physical health decreases as income increases. Higher rates of smoking are seen in those making less money. Diabetes is also more likely to impact those who make less money. Reporting no leisure time physical activity increased in those who made less money. Receiving dental care in the past 12 months was much lower in those who made less money. Comparing the 2017 to the 2021 survey, the percentage of those reporting marijuana used in the past month nearly tripled. The legalization of marijuana may have increased the number of people using it, but it may also have allowed more people to feel comfortable admitting to marijuana use. The table on the slide lists 12 of the 16 health priorities that appeared in our survey. The percentage of respondents who considered each of these priorities to be of high importance is listed by county. The columns represent the counties served by the Dickinson Iron District Health Department. DCK stands for Dickinson County, IRN for Iron County, and UP stands for the Upper Peninsula. While there is considerable variation between the counties, the top priorities include drug use, healthcare cost, and unemployment. Compared to the 2017 survey, the percentage considering these priorities to be of high importance in the 2021 survey decreased. The major exception was the shortage of mental health programs and services or lack of affordable mental health care. The percentage of respondents across the Upper Peninsula who considered this priority to be of high importance increased from 37.5% to 47.5%. This suggests that the community has recognized mental health as being more of an issue and as one that needs our attention. Bringing people together to watch this presentation is the first of many to follow as we work together to improve the health of our community. Further steps including forming focus groups and work groups to help clarify the path forward and identify the community resources needed to make progress. These decisions will be informed by the data compiled in the Upper Peninsula Community Health Needs Assessment. Although the Upper Peninsula spans over 16,000 square miles and comprises approximately one-third of Michigan's landmass, its residents are more alike than they are different. Across the region, income and education are greater determinants of health status and access to health care than geography. And as we move forward with community health improvement planning, it will be important that non-traditional partners in healthcare be at the table. The process needs to include educators, volunteer organizations, leaders in the business community, and government entities such as city council members, county commissioners, and legislatures. While we attempt to bring together a broad array of community members as possible, if you can think of people who need to be here and are not here, let us know. Finally, this is a reminder of where you can access the Community Health Needs Assessment and contact information for the people who can answer your questions regarding the assessment. If there are any questions that have not been addressed by the survey, we may have the data to answer it. Just contact us and we can see what we can do. Are there any other questions?